is recognized for 60 minutes as the designee of the Minority Leader.
Well, thank you, Mr. Speaker. I'm going to be starting this hour on behalf of my colleagues from the GOP Doctors Caucus. Congressman and Dr. Murphy and Gingrey are our two co-chairmen. We make up a group of 10 MDs and 4 other professional healthcare workers, including a dentist, a psychologist, optometrist, and we've been meeting on a very regular basis throughout this debate. And perhaps this weekend we'll have a culmination of quite a debate, and what a debate it has been all year. As I tell folks often, I ran in my election in 2008, my first election, on health care reform. I'm a physician, a family physician of 30 years. I have enjoyed the practice of medicine. I still practice medicine when I go back to my district. And for this 30-year period, I've learned a lot about the economics of health care, things that are so important. And I've been through all phases. In the early days of Medicare, when we didn't have a lot of the restrictions and restraints that we have today, during the HMO days, where we had capitated care and the so-called gatekeeper, during the days when CLIA laws came out that more or less outlawed laboratories for doctors' offices, of course, the SGR days, sustained growth rate, for the last 10 years. I've seen it all, and so have my colleagues. In fact, among us, we have over 400 years of clinical experience, and I would include our 2 physicians from the Senate in that group. What I'm going to talk about this evening is a little bit of background, and also we'll kind of get into where we are with the latest situation. One of the observations that I made early in my practice was that oftentimes economics actually control the decision making more than the actual health care itself. I'll give you a good example. I had a patient who required monthly blood tests to check his clotting factor because he was on anti-clotting drugs because of chronic deep venous thrombosis. And I could not, for the life of me, get him to get those blood tests on a regular basis. Not because he was afraid of needles, but simply he didn't want to pay the price. However, once we were brought under an HMO, Health Maintenance Organization, and all of a sudden he didn't have nearly the out-of-pocket expenses that he would have had, not only did he want to have the blood test, but he wanted to have many other tests as well, things far beyond anything that I could conceive would be a benefit to him. So for him it was a value issue. Since he wasn't paying and somebody else was paying, well, let's utilize as much as we can so I'm getting my money's worth for what I'm getting. One of the things I like to tell people when I speak to groups is think of healthcare consumption like a credit card. And if I were to give you a credit card that has a limit of $10,000 on it, and I said to you, buy whatever you need, but nothing you want. And I often ask the crowd, what would you buy? And of course, people come back with, well, I would buy probably a new shotgun to go hunting, or camo, or perhaps some physical fitness equipment, or a treadmill, something of that nature. Things that maybe I'm not willing to pay out of pocket for, but if it's your money, then I'm willing to pay it. And this, Mr. Speaker, is really the core of the problem when it comes to cost. There are 2 areas of our economy in which cost has gone up more rapidly than inflation. One is education, and the other is health care. And it just happens that